Podcasts are hot right now. How do I know? Well, you're listening to one right now, aren't you? But you might be wondering, how on earth do I get my voice out there and start my own podcast? It all seems so intimidating. Between hosting and platforms and monetization, it can get real complicated real quick. Well, I'm going to let you in on a little secret. We started this podcast over 2 years ago, not knowing clue one on how to do it. So how do we do it? We did it with Anchor. Anchor is the free podcast app with creation tools that allow you to record and edit your podcast right from your phone or computer. And Anchor will distribute your podcast for you, so it can be heard on all the platforms like Spotify, Apple Podcasts, and many more. And everybody likes money, right? Well, you can make money from your podcast with no minimum listenership. It's everything you need to make a podcast in one place. So go right now, download the free Anchor app, or go to Anchor FM to get started. It's the eCommerce Minute, your daily dose of e-commerce, tech, and retail news with your host, John Suder, Bart, Mroz, and Brittany Blackman. The eCommerce Minute is a production of SUMO Heavy, a digital commerce consulting firm located in Brooklyn, New York, and Philadelphia. Find us on the web at sumoheavy.com.
It's e-commerce minute episode 760.
In today's episode, Walmart is launching health insurance agency.
Walmart has made a litany of healthcare-focused moves this year. Last month, it acquired startup CareZone's medication management platform to help customers keep track of their prescriptions. And in February, it debuted a second Walmart Health Center in Georgia. They also have plans to expand more locations featuring services like primary care, mental health counseling, diagnostic services, and dental care. Now, in classic Walmart fashion, they're taking it a step further. Walmart will now sell health insurance along its groceries, clothing, and camping gear. The Arkansas Democrat-Gazette reported that the big box retail giant started an insurance agency in Texas, bolstering its healthcare business outside of retail. The entity, called Walmart Insurance Services LLC, will sell Medicare-related services and products. The company has already started its hiring process for insurance agents. The job posting says that the full-time licensed agents will be based in a Dallas call center and will be able to work remotely. Walmart's healthcare services are known to flaunt low prices compared with traditional doctors' offices. The retail giant stated that Walmart Health Center prices would be up to 50% lower than traditional care, a difficult bargain for doctors' offices to match, considering many primary care practices are undergoing financial strain amid the pandemic. And we definitely don't think Walmart will drop its claim to affordable care anytime soon, as its brand is well known among consumers for its low prices. So we will assume that it will offer discount insurance plans as well. Walmart's low prices and wide footprint could pose a threat to insurance startups, especially those firms breaking into the MA market. It appears Walmart may focus on selling MA plans as it's posted job listings for Medicare sales supervisors and licensed insurance agents. For context, MA plans are offered by private payers in contract with Medicare. Business Insider points out that while insurance tech companies flaunt their ability to offer more efficient and affordable care, we think that Walmart's ability to consolidate all types of care into one visit and its hard-to-beat rates may eventually have insurtechs floundering to hold on to their MA patents. If there's one place that needs to be disrupted and blown up, it's insurance. So
for sure.
No surprise here. We will see Amazon following suit. Amazon is in the background making a lot of moves that you're going to see.
Right. I mean, between buying PillPack and all that stuff, they're definitely going to have a lot more healthcare.
Absolutely. I mean, you'll just go on Amazon and order all your prescriptions, and who knows, they'll probably get into telehealth. I mean, we're speaking strictly about Amazon here, but you know, all the tech that they have behind, that's all going to get wrapped up. There's already, I think we reported something that Alexa was, when the pandemic started, it was like if you needed some counseling, it would connect you with someone. I mean, all that stuff is going to be connected, and all that stuff is going to be rolled out. And Walmart is doing the same thing in that they are using their giant footprint of stores, and just by scale, when you compare going to a doctor that is sitting in a Walmart store compared to a doctor that is sitting in a private practice, that doctor is, he's usually is sharing the rent with other doctors, and they have to pay for that office, and they have to pay for all their insurance, versus and it's the analogy of the eye doctor that sits in the Walmart. He's being subsidized by Walmart to be there, so his overhead is a lot lower, which means the prices are a lot lower. And that's why it's cheaper to go to an eye doctor at Sam's Club than it is to go to, a private optician. It's the same analogy there. And then they'll do this with insurance too. They'll do everything at scale and turn it on its head. So, I mean, it's going to be a great thing. Now it's still going into Walmart. So
yeah,
for now.
True. I think the next industry that Walmart needs to disrupt and shake up is the ticketing industry, personally.
Are you saying that from personal experience, Brittany?
No. Never. I would never say anything bad about the ticketing industry.
Yeah, it's a little sensitive, a topic for Brittany here.
It is.
There's a rumor floating around today that Walmart can and should buy Walgreens, which is a crazy thing. Walgreens is just a giant chain, but no surprise there. It's just because that's everyone's new target is healthcare. Healthcare is a little broken in this country. It needs a little fixing up. And for us to say, oh, healthcare from the government, that's never going to happen. There's just too much money involved. So if someone can put their foot in, at least help people save some money, especially people on a fixed income. That's the worst part because they're on Medicare, but there are, some people have some exorbitant bills above and beyond what Medicare can cover. Mm-hmm. And if they can help with this, and also, people who just flat broke need some health care. I mean, no shame in the game. Go to Walmart. Maybe that's going to fill a gap. I don't know. I'm not really well versed on all this kind of stuff, but that's my opinion.
Yeah, I was thinking that too. As much as we rag on Walmart and they're a very controversial company, this should definitely help out a lot of people.
Well, I pointed out to someone today, they were like, about the Walmart drive-in thing. And I was just like, Walmart, as much as people rag on them because they're just this giant company and they're the biggest employer in the country, and there's many, many reasons to dislike Walmart. Walmart also really tries to do things for the community. We did a podcast a year and a half ago where they were doing those town centers in the more smaller, more rural places where it's like, that's all it is the Walmart. So they basically said, well, let's make the Walmart a destination. Let's make Walmart you have a cafe, you have a bar, you have, smaller footprint restaurants, you have outside seating, you have patio, make it more of a destination. At least they try. I mean, of all the hate that we give Walmart and everyone else gives Walmart, at least they try and do things like that. Things for the community. Of course, it's all tied to money. It's all about the money, but
that's life.
That's capitalism, baby.
Yep.
All right. Close with a little stat time. Tim Barry, chairman and CEO of VillageMD, said that 85% of the $4 trillion spent annually on healthcare in the U.S. is tied to the treatment of patients with chronic diseases. Per Centers for Medicare and Medicaid Services, the total healthcare spending in the United States climbed to $3.4 trillion in 2016 and is expected to reach $5.5 trillion by 2020. This is an outdated stat because I think COVID probably flipped that on the head. But still, that is a big number. Medicaid Advantage enrollment forecast by the Congressional Budget Office, otherwise known as the CBO, sees continued growth over the next decade, with Medicare Advantage enrollment expected to cover about 47% of beneficiaries by 2029. You guys have anything else?
Nope.
All right, that is your e-commerce minute for today. We'll see you on the internet.
That's it for today's show. If you like the show, do us a favor and subscribe or leave us a review on iTunes. And don't forget, you can now listen to the e-commerce minute on your Amazon device. Just add e-commerce minute to your flash briefing. And finally, if you have a comment or suggestion or just want to say hi, find us on social media @SUMO Heavy.